And we're live.
Hello. Ms. Corbett.
Good morning, Mr. Chairman.
Can you hear me okay?
Yes, I can.
Okay. So I'm ready. Mr. Mary-elect Dickens wants to join us.
Yes, sir. I did send him a link.
I am here. I am on the call. Thank you for inviting me. I just joined.
Okay.
Good morning.
Thank you, Mr. Mayor.
Morning.
Okay. Are we live now?
I believe I will ask our team. Yes, we are live.
Okay, so we begin?
Yes, sir.
All right. Good morning, everyone. I'm Rob Pitts. I chair the Board of Commissioners of Fulton County, and I'd like to welcome you to this special call meeting of the Board of Commissioners. Today is December 21st, 2021. It is approximately 10:30 a.m. Madam Clerk, would you call the roll of the Board of Commissioners, please?
Chairman Rob Pitts.
Present.
Commissioner Liz Hausman. Present. Commissioner Bob Ellis.
Present.
Commissioner Lee Morris.
Present.
Vice Chair Natalie Hall. Commissioner Marvin Arrington Jr.
Present.
Commissioner Khadijah Abdul Rahman.
Present.
Mr. Chairman, you have a quorum.
Thank you, Madam Clerk. Would you check with the mayors, please, to see who's present and who's on?
City of Alpharetta, Mel Gilbin. City of Atlanta, Mayor Bottoms. Chattahoochee Hills, Mayor Reed.
Present.
College Park, Mayor Motley Broom.
Present.
East Point, Mayor Holiday Ingram.
Here.
Fairburn-
Here.
Thank you, Mayor Holiday Ingram. Fairburn, Mayor Carhurst.
Mayor-elect Mario Abrams here.
Thank you, Mayor-elect. Hateville, Mayor Hallman. Johns Creek, Mayor Bodker.
Here.
Milton, Mayor Lockwood. Mountain Park, Mayor Steele.
Here.
Palmetto, Mayor Bodie.
Present.
Roswell, Mayor Henry.
Here.
Sandy Springs, Mayor Paul.
Present.
South Fulton, Mayor Edwards.
Here.
Union City, Mayor Williams.
All right, and Mary-elect Dickens is on from the city of Atlanta as well. All right, thank you all for
Morning.
joining us this morning. Now, the purpose of this emergency meeting is to hear from Dr. Paxson regarding an update on our COVID-19 situation, and more particularly the new variant that seems to be spreading throughout Fulton County. So Dr. Paxson, would you begin?
Certainly.
Dr.
Thank you.
Paxson?
And I appreciate everyone clearing time on the day before Christmas to participate in this. But we felt very strongly that this is important information that you do need to have, because there are specific things, actions that we believe are warranted to be taken immediately. What I'm going to do is we'd like to give you an overview of what the situation is. And so my colleagues from emergency management are going to be showing you a brief presentation with the relevant information. And then they're going to turn it back to me. And I'm going to be here to answer any questions you might have. I know that a lot of people have questions about the different variants, Delta and Omicron versus Alpha. People have questions about vaccinations and their importance. And so that's what I'm here for, is to answer those questions and to urge you to take certain steps now. So Doug, why don't I turn it over to you to do the presentation, and then we can come back to me when you're finished.
Thank you, Dr. Paxton. Good morning, commissioners, mayors. I wish I had better news for you today, but we're going to give you an overview of the current situation in the county. Starting off with the CDC map for variants. This map is updated once a week. And the map you see below, orange is the Delta variant and purple is Omicron. This is 1 week ago. Omicron accounted for 3% of all cases in the United States. And then 1 week later, you see purple as Omicron is now the dominant variant in the United States, and 73%. This is already 5 days old. I'm assuming next week's chart will be completely purple. 97% of all cases in the Southeast region 4 are the Omicron variant, as you see in this slide right here. The CDC also publishes daily their metrics for masking guidelines, and the metrics is any cases per 100,000 for a 7-day period over 100. Fulton County yesterday was at 374 and rising, so almost 4 times the recommended amount. And percent positives over 10 is the red category, and we were at 10.9 yesterday and rising. So both factors that they recommend masking indoors, we're well into the category for high transmission. Real quickly, I want to talk about testing. We have been at our capacity for the last 3 weeks on boosters and capacities in vaccines in general at the Fulton County Board of Health locations. As you can see on the far right, we've been doing about 1,200 boosters a week, which is our capacity. And also some of our private partners are at capacity too. We're working very hard to extend and maybe expand our capacity in the coming weeks as we deal with this new wave of the variant. Also, testing, I know, has been in the news and concern. You can see on the far right-hand side, with just 2 days this week, we doubled our weekly testing numbers. With the holidays and everything else out there, I'm sure Dr. Paxton talked about this more. The state contract that we have for our testing locations with MACO is trying to get the right staffing and personnel there, and that's something we're working on. But we can expect these testing numbers, while we're in this dynamic cycle, to continue to grow. This is the slide from yesterday. This is a daily comparison of cases in the county and in the state in the United States. And for reference, yesterday we had 1,769 cases. The day before we had 1,340. And we've only had 2 other days above 1,000 cases, and they were last January. We were 300 and 700 over our worst days ever. And it is definitely a trend. Our 7-day average in 1 week has moved from 205 to 827 cases a day. That is 391% worse than we were 2 weeks ago. The state, as you can see, the heat maps, Fulton County and the general Atlanta metro area is definitely the sickest part of the state, but the numbers in the last 2 days from some of the outlying counties is pretty soon they will be catching up to what's going on in the metro area. But right now, the main focus is in the Fulton County metro area. United States is starting to see a little bit of a wane of the Delta variant in the Northeast, which has been plaguing them for about a month. But the country as a whole is darker yellow, which means we're at the very beginning of the Omicron surge. Probably the worst news slide on here is in just 1 week's time, we've tripled the percent positivity. Fulton County is at 14.7%, and the state is at 13.5%. Our hospitals are at 14.5%. Generally, in the past, throughout the United States, communities peak at 16 to 18%. They're expecting the Omicron peak to be well into the 20% positives, which would lead us to some pretty dire forecasts. So the latest modeling that we assemble for the county now goes out to April 1st. It's the first roll modeling that includes the Omicron variant. And for reference, this is since the beginning of the pandemic with our highs. Our current total, 827, now has surpassed last year's high and is on a pretty meteoric rise to the top. The orange line is the most probable outcome without any mitigation measures. So just going along like we're going now. So if you can imagine, we had over 1,500 for the last 2 days. By February 7th, we could be having 3,000 cases a day. And this is the most probable outcome without any mitigation measures. And then the other forecast model is for hospital beds. While we know the news has said that it may not be cause as much sickness as some of the other variants, the sheer number of cases will result in hospitalizations, and our projected peak for hospitalizations will be very close to our summertime Delta peak on March 1st with hospitalizations. And then lastly, our projection for the death toll, which has been very good since the beginning of this, projects about 150 more deaths between now and April 1st. So when people tell you that Omicron isn't dangerous, eventually people do, depending on comorbidities, progress through the hospital. And like I said, the projections for about 150 more souls to perish with Omicron as a comorbidity. I believe that's all I have, and I will answer any questions about the data, and Dr. Paxton will answer questions also. Thank you.
Mr. Chairman,
Yes.
I'd like to ask Doug, what has been the number of deaths in Fulton County based on Omicron?
Deaths are a lagging indicator, and so we probably have not seen any deaths yet. Generally, the deaths get really stretched out at the beginning of the pandemic. They were 2 to 3 weeks after onset of symptoms, but with better hospitals and better treatments, it's closer to 5 weeks. So this surge will start to show a death toll in about 4 to 5 weeks. So I would say at this point, I would hazard to guess none. But like I said, it is a definite lagging indicator.
Okay, thank you, Doug.
Other questions? All right, Dr. Paxton.
Okay, well, we felt very strongly about that you needed to see this information in front of you graphically, because as you can see, we are on a bad trajectory. And as Doug has made the point, even though there's some indication that Omicron might be a little less deadly than the Delta variant, make no mistake, throughout the world, we are starting to see people dying of Omicron. I believe that the first the first death was reported in Texas a few days ago. And this is going to be a pandemic that is going to really hurt the unvaccinated, because vaccines have been doing their job. They have been keeping people basically from getting very sick, from being hospitalized and being put on a ventilator, and from dying. However, because of the sheer numbers, we're going to see more people being hospitalized. But as it has been for the last several months, like greater than 92 to 94% of all of our hospitalized patients are the unvaccinated. And so that is why we are putting a huge push on getting people vaccinated, because for those who have been vaccinated, and I actually know that there are people on this call who have gotten a breakthrough infection with COVID after being vaccinated, but for the most part, and some of them might even be willing to tell you, they have been experiencing some symptoms, maybe mild symptoms and all that, but nothing like what our unvaccinated population is experiencing. So as I said, I'm here to answer questions, but I'm going to just tell you up front what our recommendations are, given this really exponential growth in cases and the fact that last year, when we saw our peaks, they were in January, after we had already gone through not only the Thanksgiving holiday, but the Christmas holiday. So after people had already gathered. Now look, we're as of the 23rd, yesterday, before we'd even had the Christmas celebrations, we were already higher than that peak. So we expect, we know that it's going to be much higher in January. That's why we need to make these changes now. And so based on all of this information, this is what the Fulton County Board of Health is recommending. That we go back immediately to that masking should be required at all indoor facilities, even among those people who are vaccinated and boosted. We really shouldn't be having large group gatherings. So we're going to phrase that it should be reevaluated or eliminated entirely for the duration of this period of really an emergency. And we'll have, I think, a better sense into January. But for now, we should actively be discouraging having any large group gatherings like the Christmas parties that are planned, the New Year's Eve's parties, and the like. So we need to be either limiting or even eliminating those parties and gatherings that involve large groups of people in close quarters. We are still encouraging, as we always have been, that residents should try to get tested for COVID-19, particularly if they're planning to meet with groups of people such as their family over Christmas dinner. And I will talk to you a little bit about the testing situation that we're currently facing. So again, I think it's very important that we get these mask policies back among both the public and the private sector organizations as soon as possible. And we really need to take a good hard look at all of our plans into the new year, in terms of gathering. And certainly if there are going to be any gatherings, people need to be masked. And we are also, the Board of Health is also recommending that we close certain public facilities temporarily. So for example, it is my recommendation that we should be closing the senior centers for in-person gathering now, because our seniors, even those who are vaccinated, are our most vulnerable population. And so I think we need to move to close them as soon as possible. And Dr. Rochelle may or may not be on the call now, but has already given, there are already plans that are in place, as I understand it, for the continued provision of meals, in the home delivery for that. So then what I want to talk about, because it will come up, of course, and I know you all have questions about, is the availability of testing and vaccination during the holidays. Because many of you have experienced or you've seen the long lines that are currently at the testing sites. What I need to make everyone aware of is the fact that this is not a Fulton County problem or even a Georgia problem. This is a nationwide problem in terms of there's a huge demand for testing, both from people who are having symptoms or know they've been exposed, or for people who are just planning to travel. And so they want to get testing done. So we're having a huge demand. And in addition, we have to, one problem is that many of these sites have also experienced workers being out because of COVID, calling out. And so here in Fulton County, our testing is done through a contract that the state has. And so I and others have been in contact with the state, which in turn has been in contact with the contractor, and to arrange to move people from other places and to be around to be able to try and to meet this need. And we're trying to alleviate the wait times. But what I need to do is to plead with everyone to show a bit of grace in this period. We have a a lot of healthcare workers who are out. We have, and people are doing their best. I mean, really trying to be heroic and to do this. And so I'm trying to urge a little patience, a little empathy for these crucial staff as we are trying to meet this testing need. What is also important to know is that we are strongly encouraging vaccination. So anyone who has already been fully vaccinated and is now eligible for a booster should get it. Go get it. And anyone who, for whatever reason, has held off on getting vaccinated till now, it's time to jump off the fence. This is time. You should be getting vaccinated. We have vaccination appointments into 2022. And so they've been freed up. So the public can go on the website and they can make appointments to get vaccinated. Now back to the testing. In addition to that, as some of you are aware, the federal government has made a commitment to providing rapid home test kits, I think on the order of like 500 million shortly, but they're not available yet. So what we have done at the Board of Health in Fulton County is we have taken money that we have from grants that we have been given by the federal government and CDC for our equity programs to reduce COVID disparities. We have taken money and from that about $800,000, and we were able, thank heavens, through a lot of concerted work, we were able to find a supplier that had some rapid test kits available. And we ordered them, and they should be arriving sometime late next week. And so we are hoping that maybe in the week after that we will be able to start distributing those. But what everyone should be aware of is that this is not this is a bridge between when we get from now to when we get the more abundant federal test kits. And these are test kits have been paid for through a grant that is designed for people from vulnerable populations. And so we are actively working on our plan for the distribution of these test kits, that have to follow the funding guidelines. And they're going to be targeting areas of low vaccination, high infection rates, and high social vulnerability. So I'm basically telling you to stay tuned as to when the tests actually arrive and what the distribution plan will be. We will share that information with you in order that you can share it with your constituents. And I think those are the main things I wanted to get out. So I did want to give you all a chance to ask some questions. Oh yes, I do see that there is a few questions in the chat. So maybe I might deal with those right now. Well, actually, bits of information is what I should say. Doug has put in, of course, that 4% of hospitalizations and deaths in Fulton County are breakthrough cases. So that's 4% versus 90%, which are not. So basically, it's again showing the importance of vaccination. And then there was a question from Dick Anderson about any recommendations beyond what we are doing at the jail. Any movement on Delta Airlines request to move the quarantine from 10 to 5 days, especially for vaccinated individuals. So let me tell you that yesterday, the Centers for Disease Control did put out some new guidance specifically pertaining to healthcare workers, because healthcare workers, who are the backbone of our response to these huge case numbers, some have also been having to be out because of either exposure or mainly or because they themselves have had a breakthrough infection. So what the CDC did as of yesterday was to shorten the quarantine period for healthcare workers who have contracted COVID from the usual 10 days down to 7 days, because that is thought to be a reasonable accommodation to get these people who are so crucial to our healthcare back to taking care of people. But at the moment, that is only for healthcare workers. It is possible that that they might extend that further to different populations, as the case for what's been done in some countries in Europe. I believe that England has put in a similar shortening of the quarantine period, but that's for everyone. But for now, here in the States, it is only for healthcare workers. And that's all I see in the chat. So I don't know if anyone has to have some questions you'd like to ask me about in person.
Dr. Paxton, there are several with several folks, several of our elected officials who have hands raised. Madam Clerk, do you need any assistance? Are you able to see that, or I can try to just call them out if that's helpful?
Well, let's be whoever can see, because I can't see.
Yes,
What
sir.
I would say to my colleagues on the board, though, is that I would like, unless there are objections, I'm going to direct the manager and Dr. Paxton to implement all of your recommendations, unless there are objections from any of the board members. We don't meet again until the 5th, but in the meantime, we'll be open on, not open on Monday, but open on Tuesday. And I think this is such a dire situation that we need to take every possible precaution. So unless there are objections, I'd like to begin on Tuesday morning. All right, questions?
Can we continue the conversation, please, before we take some action?
Sure.
We've got 5 people with their hands raised, Mr. Chairman.
I can't see the hands, so can you see them, Ms. Corbin?
Yes, and Commissioner Hausman does have her hand raised since she's at the top of the
All
list.
right, Mr. Hausman. Mr. Hausman?
Thank you, and I'm not sure if I'm jumping ahead of anyone, but I'll go ahead. I see Commissioner Rockman, Mayor Motley Broom, Mayor Edwards, and Mayor Williams, and Mayor Boxer also have their hands up.
You have the floor, Commissioner.
Okay. First of all, we all recognize that this is a changing situation, rapidly changing situation that we do have to take precautions with. I am a little concerned about the actions of, still continuing to not recognize that folks that are vaccinated should still be able to gather and be with people as long as they take precautions. And I think masking is a safe thing that everyone should be doing when they're gathered with other people. So I'm a little hesitant, especially with our seniors, to take away something that may be really important to their mental health as we go through this next phase. So I'm just going to say that. I also would like to know, now that there has been some treatment options approved by the FDA that has just happened in the last few days, we will be incorporating that into our protocols from the health department to help, stem any people that do get it from ended up in the hospital. So could someone please speak to that?
Yeah. Do you want me to jump in now, or do you have more questions?
No, that's
Okay.
it. I'll let others speak. I may have one after you answer the question.
Well, I'll answer obviously, I disagree on your first point. So, I think that the data speaks for itself in terms of the number of vaccinated people that are still getting sick. But let me jump to your second point about the new therapeutics that have been recently I was actually just trying to look for the email that all of the district health directors just recently received from the chief medical officer at DPH. And what you need to understand is that these new treatments, which we're all excited about, are in extremely, extremely limited quantities. In fact, I believe that at Grady, they're being allocated. And I think that a Grady only has like maybe 20 doses or something like that. I mean, because we've got an exploding epidemic and we've got extremely limited quantities. So in fact, what I think we have to just be realistic is that we cannot guarantee that any one person will have guaranteed access to these things because of the limitation of their availability. So while we're happy that they're available, and while we're hopeful that production will be able to be ramped up in a short period of time, that's really just not the situation now. These things, they're not, for all intents and purposes, these are not widely available.
Well, that's what I had heard being reported. So I just feel like it's important that folks to understand that that's going to take time but you are planning to incorporate that into our protocols when that is available. Is that what I'm hearing you say?
Oh, of course. We incorporate all proven, treatments into our protocols.
All right, so again, back to the large gatherings. I mean, we still have sports events happening, concerts happening, airline travel, the airport is packed. All sorts of large gatherings are occurring. Are you suggesting that those should also be stopped?
It is my recommendation that, that unnecessary large gatherings should be avoided. Obviously we do not have the power, nor would we wield it. We're not going to go and shut down the airport and say no one should be flying. That's not going to happen. But we are suggesting, people need to know that this is a rapidly expanding epidemic. And so that if you're going to be in a large congregate setting, you are taking a certain risk. And so at the very least, we want to, if you're going to be at one of these, large sports events or something like that, you should be masked up. You should be trying to be socially distant because that's the realities of a respiratory epidemic.
Thank you for that. And my final comment, that's kind of my point, Dr. Paxton, is that if you are vaccinated, and perhaps we could, make that be a requirement for our seniors to participate, that might be a way to allow them to still have what is vital to, again, their mental health activities, to make sure that they do mask up and that they're vaccinated to participate. I'm just very hesitant to pull the rug on those programs that I think are pretty important to our seniors. Thank you for all you're doing.
Next.
Commissioner Abdur-Rahman is also has her hand raised.
Right, Commissioner Abdur-Rahman.
Thank you, Chair. Couple of questions. In our testing, I don't want to make the assumption. Our testing, we are testing for the Omicron variant, and are we testing for any other variant?
Okay. The current tests that we have will pick up an infection that, whether it's caused by Delta or Omicron. So I know some people are worried that we're not, that there might be undetected Omicron infections out there. That's not the case. But in order to actually type the variants, that's an additional laboratory step that has to be taken. So it's not we don't necessarily do that, particularly with these large numbers of 1,800 a day or something like that. We're not typing each one of those. Well, what you do is you type a sample, and that's how you're able to tell what the proportion is. And so that's where that comes from. It's not that we don't send that we don't do that expensive typing test for every single positive case, but for a big proportion.
Okay, because I have had constituents to ask. And Dr. Paxton, are we doing anything in conjunction with the Fulton County school system? I did have a couple of the representatives of the board to reach out to me late last night with some concerns. So I don't want to make the assumption, even though I would think that you all would have a collaborative effort, but for the sake of the public, I do want them to know that the school system, we are on board with the school system as well as the county commission and whatever we determine, what are the best practices.
Well, absolutely. In fact, for the Atlanta public school system, they call meetings of the board, and I attend those virtual meetings to talk about the COVID precautions. With Fulton County, Fulton County school system, we also are work with them. They're not necessarily reaching out to me when they've made some major decisions, about various things without necessarily reaching out just beforehand. But just yesterday, I did in fact contact Superintendent Looney to make some recommendations, to ask him to consider to make some recommendations. And he answered me back at relatively late at night saying, yes, he's having a briefing on the 28th, and he's going to be calling me, immediately after that. So we are doing our best to work with all the schools, both major school systems, and with any private school systems that want to consult with us. Our doors are open, and we do that on a routine basis.
Thank you, Dr. Paxton. This is more of a concern than it is a question. I support us doing what we need to do to keep our constituents safe. Having said that, we do need to make sure from a communications perspective that we are going to have people that will maybe panic. We are going to have people that are going to possibly be fighting depression. We are around the holiday season. So I would want us to have a concerted effort across the board to make sure that we ensure that our constituents have access to any hotlines, any things that they may consider to be as a result of it look like that we're going back in lockdown, which technically we're not, but for some of our constituents, it does feel that way. They've already started calling me. And so I just always like to be on the same page as many of my colleagues and elected officials as possible, as well as your organization. So I just want us to know that we are going to have some individuals that are going to possibly panic, possibly suffer some symptoms of distress, or just really being upset behind this. And so we need to make sure that we, one, let them know what they need to do, and two, if they start exhibiting certain things, that Fulton County is here to help them for not just their general physical being, but also for their mental wellness as well. Thank you.
Thank you. I appreciate that. And I really want to emphasize that what we're trying to do is we are not trying to encourage panic. We are trying to encourage preparedness. And that's why we have these very specific recommendations about vaccination, wearing a mask, avoiding large gatherings, because that's part of being prepared for this.
All right, who's next?
Thank you. Mayor Motley Broom.
Thank you. Dr. Paxton, I have a few questions for you. What has South Africa shown us about what we can expect here? Because I think that they are already experiencing a decline in cases and with a relatively large spike that occurred. And so I'm curious about what they're seeing in terms of hospitalizations and deaths, because they're ahead of us by a few weeks.
Sure. Well, obviously, I don't follow the South African statistics as closely as I follow Fulton statistics. But given my particular interest in Africa, having lived there for 10 years and worked there, I do still follow them. And yes, there are some encouraging things coming out of South Africa. The one thing you have to keep in mind is that they actually have a lower number of people who are vaccinated, which is very interesting with this. But it does look as if the fact that Omicron might be somewhat less hard than Delta, that seems to be holding up, because there were fewer hospitalizations, and there is there was that very high peak, and it is starting to come down. And as an epidemiologist, I'm actually hoping that is the case, and it would make some element of biologic sense, because if you have an infection that rips through a community as quickly as Omicron does, and you do then afterwards have even a short period of immunity as a result of having had that infection, then you could expect that you might have, at least for a period of time, you might see cases falling. And so I just want to see cases fall, and I'm hoping that will happen. The problem is, relying on that as a strategy is that usually in the way there's a lot of collateral damage. When an infection rips through a community like that, there are vulnerable people who are going to fall. And so that is what we're trying to prevent here.
Thank you for that. So in talking with people in my community over the last several days, there's a lot of fatigue, and I'm sure that is present in all of our cities across the county. So what would you say to people who are thinking at this point, well, this variant is not as severe, they're experiencing a couple of days of difficulty and then recovering? Why do we have to take what some would see as extreme measures at this point that kind of derail our progress toward normalcy? What would your response be?
Well, I totally understand it, because people say they're tired of this of the epidemic. No one is more tired than I am of it. But unfortunately, as we've seen, the virus is not tired of us. And what I am encouraging people to do is to not think, actually, the things that we are proposing are doable. To go get vaccinated, a vaccination takes half an hour out of your life, okay? And, it's available at CVS, at Walgreens, you can walk in. My daughter got her booster, she just made an appointment, she walked in. So that, and putting on a mask, I know that there's a small segment of the population that acts as if putting on a face mask is asking someone to, well, anyway, let me not push this analogy, but anyway, wearing a face mask is not, a big ask, and it can do a lot for protecting your people who are around you. It can do a lot for protecting yourself. So these are not really big asks, and to basically to be mindful of your actions, to be mindful of your potential for getting infected yourself or passing on an infection should you have one. That is what we're asking. So I think that I'm encouraging people to not think of this as doom and gloom, that, oh, all of a sudden everyone's going to be, locked, confined to quarters, locked into their houses for the rest of, our lives. No, we're asking for a grace period so that, because we know this is the period where we're going to be seeing the most cases, probably into the middle of January. And that this is why we want to take these precautions now. So there's a certain segment of people who, no matter what I say, they're going to think that, oh, I'm going to ignore it. But I don't think that this is a big ask. I want people to be mindful and to take these reasonable precautions.
And I think this is a two-part last question. Can you give us a little bit more insight as to how this variant is more contagious, and any recommendations in regard to face masks? Should we upgrade them? And if so, what should we be looking for?
Well, the scientists who are looking at this, like in the laboratory and, all that, I think from what I've read, what it seems to be is that this particular variant, Omicron, has a stronger predilection for cells in the upper airway as compared to Delta, which had predilection for cells in the lungs, and which is a reason why Delta caused so many pneumonias, lung problems, and to the fact that every 1 out of every 10 lung transplants being done in the United States nowadays is because of COVID. Okay, and I think that partly it's because that Delta has a preference for the lung, whereas Omicron in general, again, I'm talking broad generalities, seems to have a preference for the upper airways. Now, so that's good in terms of causing damage to you. Everyone would rather have a head cold than have pneumonia. But it also means that it's much more accessible via talking, via coughing or whatever to be spread. If most of your virus is up here, then it's a little bit easier to spread. So in terms of, I'll just be honest and tell you what my plans are. If COVID doesn't get me, I'm scheduled to fly to Antigua for a twice postponed trip, for a week. My plan is that I will wear an N95 mask during my 4-hour plane trip, because I don't know what the vaccination status is of the person next to me or sitting next to me or behind me and all that. And that's going to be 4 hours in relatively close quarters. You know, I'm going to be wearing an N95 mask. But for the most part, what I generally wear, because I know N95 masks can be a little harder for people to wear, and so I use a lot of our Fulton County masks, which are two cloth, double cloth, and it's got a nose bridge, so it fits well. I make sure my mask fits well, and I wear it, and I have a clean one every day. So, I'm kind of judging my risk. So if I'm just going out to a quick run into the drugstore, in and out and all that, I just put on my Fulton County mask and I'm good. For this long plane ride, I'm going to be wearing an N95 mask.
Thank you so much. I appreciate it.
Thank you. Who's next?
Mayor Vince Williams.
Thank you. Thank you, Chair. Thank you, Chairman Pitts, and thank you to all of the commissioners that are on the call. And thank you to everyone who joined. This is certainly a timely conversation. And Dr. Paxton and the rest of the medical professionals, thank you, because we can't or couldn't get through this without your guidance. A lot of what I have to say is not question, if you will, but one thing I do need to note is that we need to make sure we stay in communication with one another. Fulton County is a large county, and we've got to make sure that the message of what our medical professionals are sharing with us gets across. Certainly this is about saving lives. I know we've got concerns around taking things away from people, but this is about saving lives. A lot of my reading is done from a scientific perspective. And certainly this virus, SARS-CoV-2 Omicron variant, will be spreading and has been spreading through the population, as we all know, but it's not clear in the math of its total impact right now. I am not a physician. I just do a lot of reading. I have a scientific background, but I did want to share this. And also it's likely to touch all of us, regardless of the measures, such as canceling meetings or canceling events. Just a few weeks ago, there were just a few scattered cases of COVID-19 Omicron, and now it is accounting for over 70 to 80% of the cases that we're seeing. Case numbers will continue to go up, but hospital admissions and deaths are not likely to follow as they were when the population was largely unexposed to the virus. The increase of admission and deaths will likely occur regardless of these extra measures, but it's important that we get vaccinated, and especially after vaccination, get boosted. This is, something that we've got to make sure we get across to our community. As we've been sharing with people, this virus will find you. It's just a matter of time. It's not if, it's when. Your decision is whether you want to be prepared or not for that particular meeting. So my guess is this last wave of the infection right now, hopefully, that we will see before this is called an epidemic, because it hasn't been called an epidemic yet. But please get ready, because that is what is on the horizon. So I just wanted to share that. And Dr. Paxton, I can't thank you enough for what you do each and every day, making sure that our communities are safe. And a lot of your instructions, we are already moving forward in Union City to make sure we do just those. So thank you so much. And thank you, Mr. Chairman, for allowing me that time.
Who's next?
I think the next on my list in order is Mayor Bodker, and then Vice Chair Hall.
Dr. Paxton, to you and your entire team, I want to say thank you. Your efforts have been noted and appreciated. Chairman and the Commission, I thank you as well. I may not agree with everything that you're saying, but mine are more of comments. I try to judge my information as locally as I can. I check in with my local hospital here in Johns Creek constantly. The impact of Omicron up until now has been on the hospital workers, who are all vaccinated, and boosted, and are all breakthrough cases. Luckily, they're all mild and they're back to work as quickly as possible. And the new CDC guidance will be helpful in keeping the hospital fully staffed. That said, the number of cases from a hospitalization standpoint to this date are very low. One of the things that's bothered me is I agree with Mayor Motley Broom. I think everyone is pretty exhausted. I'm personally very exhausted, and I'm not trying to take away from anybody. But I also see a lot of intellectual dishonesty with what's happened with this whole thing. What I've found that's worked best in Johns Creek has been not mandating, but simply pointing out the facts, providing the information, and letting people make the appropriate personal choices. I think at the end of this, the thing that I heard most in your comments, Dr. Paxton, was judging your risk. I think it is important that we judge our risks, but at the end of the day, I assume that the public is fairly intelligent and can make the decisions about judging not just the risk to themselves, but to others in the process. And I found it interesting that one of your comments was about understanding the vaccination status of those around you. The reality is we're finding that those that are vaccinated can transmit COVID just as much as those who are unvaccinated.
That is unclear, and untrue, and I'll explain that when you're finished. Please continue.
I think the point is they can transmit it.
Mm-hmm.
And so one of the things that I'm finding that's interesting, I was having a conversation with my brother who's going to be taking a trip. And we were talking about what was going to happen on the other end of that trip because he happens to be traveling somewhere where up until recently they were having mandatory quarantining upon arrival. And he said, well, if you're vaccinated, everything's good. And if you're not vaccinated, obviously, you've got issues. And I said to myself, well, they're not checking the status of the vaccinated people to see if they're sick or not. They can still be asymptomatically transmitting the disease. So look, at the end of the day, here's my real point. My real point is Johns Creek has been at the lowest end of the scale for most of the pandemic. We have not mandated anything throughout that process. What we've done is done as much education as we can, and that's one of the things I have most appreciated about you and your team. We have given folks the message that we hope that they will do everything that they can to protect themselves and those around them, but that we leave it up to them to make their personal choices. And I think we're still at that point, especially in light of what the data is telling us, and that is that the hospitalizations in this wave are minimal, and we hope they stay that way. And I'm not minimizing anyone who should perish as a result, but that's a choice at a certain point. And the last thing I'll say is that CDC is also, as I understand it, saying they're expecting this to be a very quick wave because of the infection rate, and that hopefully with that wave it'll pass. But it's unfortunate because I think we're going to see the next wave. I mean, we're not done with this, and we're not going to be done with this for a long time. So at a certain point, if we exhaust people fully, we're going to get worse non-compliance than we have even now.
Okay, thank you. I just wanted to address one statement that you made about the transmissibility. Of course, anyone who is infected has the potential of being able to transmit. But what we do know with the Omicron variant and with vaccinated people is that people who have a breakthrough infection and they are vaccinated actually they clear their infection faster. So they have a shorter period in which they are infected. So basically, if you look at the numbers, that the likelihood of infection is greater for people who are not vaccinated. So I just want to make that clear to people.
And I appreciate you making that clear. And that was the same thing that I heard from my hospital. Dr. Paxton, nothing in my comment should be interpreted as a fight against vaccination. At the end of the day, though, I still bring it back to one simple thing. Mm-hmm. And that is whether people choose to be vaccinated or not is a choice. Mm-hmm. It is a body autonomy choice, no different than anything else. And I am just against government mandating anything. At the end of the day, I hope people make the right choices. I'm messaging for them to make the right choices, but I still accept the fact that as individuals, we have the right to make a choice.
Thank you. Vice Chair Hall, I believe, is next in the queue.
Yes, and I also want to say that Chairman Pitts is unable to participate, but he is listening. So I will be presiding over the meeting from this point forward. And excuse my voice, I have barely a voice. I was around a lot of vaccinated people who caught COVID, but I keep testing negative. So I don't know what that means, but I can tell you that I have no voice. If I talk too long, I might just cough, but I'm doing well. So a couple of things. First, I want to thank Dr. Paxton, and I want to thank Matt, because you are handling this situation like champions. And I just want to commend you for that. And thank you for moving so swiftly to do this emergency call to action of all of us. Dr. Paxton, on Tuesday of this week, constituents were calling, texting me and everything, because the Board of Health Center on Boulevard and Highland Avenue ran out of tests. And this was not a situation that was startling to me at all, because it's something that I was hearing that was spreading across the county, that more people are testing and the demand for tests is up. But I just want to make sure that we have something in place to help us not run into this situation again, because one particular constituent told me that she was exposed to COVID and she had a heart monitor, and it was imperative that she received a test to ensure that she didn't have COVID. So if you could just explain the measure that is being taken to ensure that we don't run out of tests.
Certainly. Doug is on the line too, so I'll have him help me here. I'm not aware that we actually ran out of tests. What I do know what happened is that we were short on staff. Because when I say we, this is the contractor that does this. They were short on staff because of the call outs there. So and then, as I said, I spoke myself to the commissioner, Dr. Toomey, and they spoke to the contractor, and the contractor did is bringing in more people and reassigning people. So, we're doing as much as we can, everything that we can to keep all this running. I don't think that it's, I'm not aware that it's actually not having the physical tests. We have those. It was the manpower. And so they're, staffing up again to make sure that we can attend to all of these people who need to get a test. But, Doug, do you have anything to add to that?
Yeah, I'll back it up. We get reports every day of vaccines that are available, tests that are available at the sites, and along with what they do in a day. We have not run out to date. I don't think that's the issue. Like you said, it's personnel is the issue. And like I said, the state is working with their contract. We give them the locations, and the state manages the contract, and the state's well aware that personnel is the issue, but we have not run out of tests.
If I may, I think the clarification point here that Commissioner Hall is probably looking for is that while we still offer PCR-based testing at all three of our fixed sites, the concern was that they ran out of home test kits.
No,
you just cut out, Matt.
I'm going to read you exactly what this citizen said. She said, on Tuesday, she said, learned this afternoon at 2 p.m. that I had been exposed to COVID, arrived at the Fulton County facility at the corner of Boulevard and Highland, where I waited in line for 30 minutes and was turned away at 3:35, along with a line that went down onto Highland Avenue sidewalk because they ran out of tests, Natalie. That's exactly what she wrote.
I think she was misinformed. I think she might have, she said ran out of tests, but that wasn't actually what happened. Again, it was personnel.
Okay, well then someone needs to ensure that the personnel who are there present the correct information to the citizens, because they were all told that that facility ran out of tests. So I just want to make sure that moving forward, we don't have the same situation. That's all. We just want to make sure our citizens are either well informed or at least served in the manner that they expect to be. That's all.
Okay.
And then the other thing is, I heard earlier some information about working with Fulton County schools. And I just want to also ask about the work that's being done with APS schools. What is going on with our collaboration with them and Dr. Herring, our new superintendent?
Certainly, I'm going to tag team this with Doug and Matt because they also deal a lot with these schools. As you are probably well aware, because you might be seen it, is the state and Fulton County is supporting the testing programs that are being done in the school. We provide Binax Now test kits to Viral Solutions, and they have an ongoing testing program in the APS schools. All schools are eligible to sign up for this program. It has to be done. All they have to do is contact the Department of Public Health, and they can be put into this program. So that is an option that has been out there for quite a while, that is available to all schools. In addition, we've done an enormous number of vaccine events in association with the schools, with both Fulton County schools and with APS schools as well. And then what I was specifically talking about is that both of these large school systems have standing advisory boards, and the Board of Health participates on those. And then I'm going to ask Matt and Doug, who have very regular meetings with them, to add into this. And Mike, Matt, I hope your mic is fixed because you dropped last time.
Sorry about that. Yeah.
Okay.
Thank you for stepping in. I apologize, technology. No, we work very closely with both the chief health officers for both of those Atlanta Public Schools and Fulton County Public Schools. Multiple meetings a week with them, working on initiatives. We actually just met yesterday with both school systems as well as all the municipal partners to make sure they knew what you all are seeing this morning. We will be reconvening with them after the Christmas holiday to go ahead and look at what actions they need to take coming back into school, similar to what Dr. Paxton said. So a lot of effort and emphasis has been placed on our student body to make sure that, one, we're vaccinating them, two, we're giving them the most up-to-date information so they can make informed decisions.
Thank you so much. And next I see Mayor Tina Holiday Ingram.
Thank you, Vice Chair Hall, and thank you, Dr. Paxton, for relying on the data and the medical experts and making your recommendations and not politics. I will say East Point reinstated our mask mandate August the 2nd of this year. So we've had a mask mandate, indoor mask mandate, reinstated since that time, and just approved our 10th emergency ordinance on this past Monday to continue our indoor mask mandate. Look, masks are necessary to save lives, and we're gonna continue to follow the data and the medical experts in making our decisions. And so, yes, there is a right to choose by everyone, but Roe versus Wade is at peril right now in the US Supreme Court. My daughter turned 12 on November 22nd. I took her to a doctor appointment on September the 1st. She had 35 vaccinations, and during that medical appointment, she received 2 more. So she was at 37. When she turned 12 on November 22nd, on December 2nd, she got her 38th vaccination. And yesterday she got her 39th, so she could be fully vaccinated with COVID. Look, I respect and understand medical exemptions and religious exemptions, but politics is not an exemption. And what we know is over 800,000 people have lost their lives to COVID. And as leaders, in challenging times, it's good to lead when things are great, but in challenging times, we have to lead and follow the data and the medical experts and science and not politics around these types of decisions. And so again, I am vaxxed up, boosted up, and I mask up. I encourage people to mask up, vax up, and boost up. My whole household is vaxxed up, and within the appropriate time period will be boosted. We have to get through this. And every time we think we might be like on the horizon of being able to get back to normal as we know it, I don't think we'll ever go back to times as they were pre-COVID. There's another variant that pops up. And so we have to take this seriously. We have to lead by example. We have to give clear messages based upon the data and the medical experts. And yes, everybody has a right to choose, but let's not act like in this country that right to choose is not politicized on a number of different levels. As a woman, I'm most at peril, right? Roe versus Wade. But so let's lead differently, and let's set the example, and let's be clear in what we're saying and what we're messaging, because people are dying, and it's up to us as leaders to do everything that we can and to lead the way to make sure that we are doing all that we can to protect the life, health, welfare, and safety of the people that we have the honor to serve, and give them the right information so that they can make their own informed decisions. And the reality of it is, at the beginning, there was a lot of vaccine hesitancy. But as time has gone on and as things have progressed, I think people are making decisions about it and changing their minds. And so that's why we continue to have daily testing in the city of East Point and at least a weekly vaccination site. And so again, thank you, Dr. Paxton. My question, I know I said a lot of statements, but my question is, will your PowerPoint be provided to us so that we can make sure we have that information that you share? Because I feel like it's critical information. So we'll PowerPoint, the information you share.
I'm sure we can send that out. Jessica and, well, Matt's unmiked, but yes, we can certainly share that with you. Go ahead.
Dr. Paxton, we will send this out after, along with some other communication points.
Thank you.
Thank you.
Thank you, Mayor Ingram. Mayor Bodie.
Yes, Madam Chair, thank you. And let me just point out, this is an ask. You know, I realize that the county is completely in control of their facilities and anything else, but I address this to Chairman Pitts and the rest of the commissioners. Please don't close the senior centers completely. Don't lock this thing down. You know, we've got limited access over there. Nobody's taking any meals there. But we do have small groups that come in, and they may be in the quilting room, they may be in the computer room or something like that. And of course, the mask mandate, you know, is posted there on the door. They don't let anybody come in without it. Only thing I would ask is maybe require a vaccination card in addition to your mask, you know, to enter the facility and stuff like that. I know 5 minutes away, we've got the community center here in Palmetto. It could take you up to 30 minutes to get your vaccination. So anybody any of the seniors want to go to that center that we make it available to, they can know that that's the option, and they can go get a vaccination shot, and they can get the mask, and they can go in. And like I say, it's not an all-day situation, but you know, when you lock that door back, it's going to force these people just to stay at home, and many of them are single, you know, they don't have spouses anymore and stuff like that. So they're just there sitting and looking at those four walls. So I don't really think that that's a big ask, but I would ask that of y'all today is please don't lock down those senior centers, control them, you know, who's in and out of them, the numbers and anything else. But, you know, it can be controlled definitely like anything else can. So, you know, I just ask you that. And I do have a big thank you today to Jessica that was able to pull this thing. And I don't know if it's just me. Y'all realize this is Christmas Eve and I don't have all my shopping done yet. So as soon as I get through here, I'm probably headed to Target. But Jessica made a concerted effort. She sent me a text, make sure I got the email last night at 7 o'clock. And my response was, no, I did not. You know, I had left the office at 5 o'clock. So she got me on board, and that's why I'm here. So thanks to her and the rest of the folks for being here with us today. And that's the only thing I have, but that is a big ask of y'all. I know y'all are wanting to take some type of action before we get off of this call today. So please consider that if you will.
Thank you, Mayor. And yes, absolutely. Thank you, Jessica. The lineup is Mayor Edwards and then Mayor-elect Andre Dickens. Go ahead, Mayor.
Thank you so much, Vice Chair, and thank you for all that you do, Dr. Paxton. I always enjoy these intellectual conversations about topics of this matter. But you know, we have to really talk about and take seriously whether rubber really meets the road and how do we get there. First of all, let me ask the first question that I have, Dr. Paxton. Talk to me a little bit about how this variant has affected children.
We are still gathering data. That's the nature of science. So we're still, pulling it in. It looks as if it's because of it's so transmissible. It's infecting more kids, but luckily for all of us, as has been true throughout the epidemic, even though there are some children who die and there are some children who get multi-inflammatory system, MIS syndrome, and there are some kids who get long haul COVID just as adults, it's at lower levels, much lower levels than adults. So, but children still remain incredibly, they're in very good vectors of transmission. So, they may or may not be sick themselves, get as sick themselves, but yes, they can still transmit onto other people. So I think of people as both individuals and as part of a community. And so, somebody might do very, very well themselves if they get, a particular infection, and then pass it on to somebody else who'll die. So, so to answer your brief question, in general, kids do much better with this and with Omicron, but they are getting it at higher levels than with the other variants because it's so much more transmissible.
My next concern has to do with a unified communication.
Did everybody freeze or just Mayor? Just the mayor. You frozen.
Yes, I think the mayor froze. Well, while we wait for Mayor Edwards to come back, let's move on to Mayor-elect Andre Dickens.
Hold on.
Oh, there he is.
Okay.
Hold on.
All right, Mayor Edwards, please go ahead. Unmute.
Ms. Paxton, did you follow me so far?
No, you cut out quite a while, quite a while ago.
I was talking about uniform communication, right? And having the message. And I was giving the example of the fact that at one of our council meetings, I had a council person to say, it's not that serious. Well, in public. And I'm saying to you is that is not along the lines of the unified message that we should be giving people. And I think that the other thing that happens in our messaging is that we sometimes want to compare one city or one county with each other. For example, well, if East Point's doing it, why do we have to do it? Well, East Point didn't take that, or College Park didn't take that. Why should we do it? Or Atlanta. I think we should be trying to do what is good for the majority of the people that we serve. And this unified messaging, whether it be from Fulton County Board with you, Ms. Paxton, or to all of us, I think it would go forward to help people understand what's going on. But if we say we're for something, and then we get out in the street and tell our people something different, we're not achieving the kind of effects that we want to achieve. The next thing I wanted to ask about was, Dr. Paxton, do you think that, we're talking about constituency, people, and things of that nature. My big concern is that we, as elected officials, were tagged with the responsibility of delivering service. And do you recommend anything as far as our employees? Let's go beyond fire and police. Let's go to guys who pick up the trash, the guys who does the sanitation, all of these guys that we can put into our regulations or our suggestions that will help us even ensure even more that these people stay healthy so that we can deliver that service. And I know sometimes the law gets in the way of that, but we need to make sure that that they stay healthy so that those services can be delivered.
Okay. Well, my recommendation for them is actually, because our recommendations are simple and I hope clear, it applies to these categories of people you're talking about. They should be getting vaccinated, they should be wearing masks, and they should be social distancing. Now, how you bring that about in your various municipalities is really, what can I say? It's up to you. As I've heard just today, there's clearly a very big, there's a wide variation of thinking among the elected officials, even on this call, about how these mitigation efforts should be employed or whatever. So it is not my role as the head of the health department to mandate what every group should do. My role is to tell you what the situation is, to make recommendations based on the science, but then it's over to you all to decide what you're going to do in your various spheres of influence. So
I think you're correct. I think we need to be on point together as much as possible. I think Mayor Holiday Ingram hit it on the head in her comments. And I just think as we go forward, we need to do that. And so thank you so much. And Mayor Andre Dixon, I hope you're feeling better. And y'all may not want to go to Target anymore because Clark Bode is going to clean it out for 6 o'clock. Thank y'all so much.
Thank you, Mayor Edwards. Mayor-elect Andre Dickens.
All right. Good morning, everybody. And thank you for the invitation to this meeting. I'm honored and great to be a part of it. I've been listening the whole time. And I will make sure that I'm attentive and available for as many of the Fulton County Mayor's meetings as possible so that we can be participatory together, Atlanta with all of the other jurisdictions in our region. So count me in, please continue to invite me, and I'm thankful that you did. So I had one observation and then a question. So one is, of course, I don't know who else on here has tested positive. They tend not to show you on the news as much as the minute I was positive that made news. But it's important to let folks know as we go around doing our work, to let people know that you're sick with COVID symptoms or that you are positive. And once I tested positive, I was testing every 2 days for like the past week and a half, or actually at this point, the past 2 to 2.5 weeks. We were testing every other day, and I was negative. And then on Monday, I tested positive, and so did my scheduler and a friend that's a campaign advisor. And then like the next 2 days, then my executive protection, one of them tested positive, and then somebody else. So, I mean, I share that information to say that, I don't know when I contracted it or where, but from what I've heard from Dr. Del Rio, and even similar information from this Dr. Del Rio at CDC and Emory, and then also from Ms. Paxton here, your viral load has to build up enough that it may take 3-4 days from when you contracted it before you test positive. So it is important for people to get tested every 3 days or so. And I mean, I let the scientists tell us that, but I'll just use it myself as an example that I was testing often and wearing a mask, but I did encounter individuals at a time at a couple of events where, what it was, the social order of that event was one that you didn't wear masks as much. I entered with a mask, and then I spoke on a microphone, and then I came off the stage, and people are talking and hugging and, excited, and I didn't mask up, at that moment. Then I get back into the parking lot, get in my car, and I go, and I'm with a mask at the next spot. But you just don't know where it happened. But this is how our population operates, right? So they go here with a mask, there maybe not, here with a mask, maybe not. So it is my message that now I was masking 85, 90% of the time, but I can imagine 2 or 3 times where I was not masked, or whether it was such a, quick encounter that I didn't know that it was happening. And I'm vaccinated, by the way. So I share that to say, hey, continue to tell people to mask in any incident, whether you're indoor, outdoor, whatever. And then to constantly get tested. And I was lucky that we have tests at City Hall, so they test me when they we have a schedule. But those folks that's waiting in long lines sometimes get discouraged to do that. But we have to continue to remind them to get tested every so often if they've been exposed. So my question is twofold. One is, can we have this meeting again with more information next week, as we can probably help promote safety during New Year's Eve and even my inauguration activity. So if we were to, I don't know how fast Dr. Paxton and available you'll be over holiday, but maybe Wednesday, Thursday to have another scheduled call like this, just to update us on, the hospitalizations and the positive testing and any other guidance you and the CDC would give. So I'm making a suggestion that maybe we all kind of plan now for a date next week so we can talk ahead of New Year's Eve, so that then we can rapidly use our communication tools to tell people be safe New Year's Eve. And then the inauguration stuff is all outdoors, like at Bobby Dodd Stadium at Georgia Tech. And masks are required, and we actually requiring a negative test and some other stuff. So, but I'd like to know if more information comes about next week, so that if it is more information, then I have to make a decision to cancel all of that, because it's all outside. And even Sunday, the church stuff is the interfaith stuff is all virtual. But I just wanted to lay that out there and ask for your thoughts on a meeting next week, and also for you to provide more guidance as we go into New Year's Eve.
Well, sure. Well, it's nice to meet you virtually, Mayor-elect. I was actually looking forward to your coming into the Board of Health until it had to be postponed. I was all set to come up and see you and introduce myself. So we'll hopefully still have that opportunity. Yes, I've been noting down what you've been saying. I think the Board of Commissioners and everybody here, they know that I'm available at the drop of a hat, because I will talk about COVID until your ears drop off. And so that's kind of my mission in life. And so I'm available next week. And so if Jessica and the other staff can, pull their magic, I think we can, I'm certainly willing to have another update for anyone who requires it. I did want to address a couple of things that you said and that have also come up in the chat just recently. One thing I just want to, it's great that, I like rapid tests, and I love the fact that, and we are encouraging, and as is the federal government, that we make these more available so that people can test themselves, like even every day or whatever. We're not there yet because we just don't have them. But there's one thing that I realize that people don't seem to quite understand, is that a rapid test is less sensitive than a PCR, first of all, okay? It's good at telling you if you at that moment are infectious, if you have enough virus to pass on to somebody else. But it doesn't necessarily catch up. Let's say you were infected at, the night before, and you do your rapid test in the morning. You might not yet have built up enough virus to be picked up by this test, okay? You're probably not that infectious at that moment, but it doesn't mean that by that evening or by the next day or so, you might be infectious enough. But what I've been seeing a little bit too much of is people taking a rapid test maybe 2 days before a party and thinking they're good, okay? So the closer that you can take a rapid test, assuming you have access to one, before the event you're going to, the better you are. So for example, if you're going to have a Christmas dinner with your 90-year-old grandmother, and I would take that test 15 minutes before I, in the car before I walk into the house. I mean, that's the sort of thing. I just want to, it's a subtle distinction, but I see a lot of people thinking they're kind of one and done with the rapid test. So maybe I don't want to obsess on that, but I just want to, make sure that people are aware of that it should be done as close as possible to whatever event you're having. I like the fact that if your inauguration outdoors is good, masked is good. So, I mean, I think that, we'll talk more about that, but I think that, you're on the right track with those. A couple of things that have come up in the chat are about the cleaning of surfaces. And I want to emphasize to remind everybody that COVID is a respiratory infection. It's transmitted primarily via aerosolization and airborne droplets. And so at the beginning of the epidemic, people spent time maniacally cleaning, surfaces and all that. That's not really the way it's transmitted. So that's why we keep coming back to masking, okay, because that is the primary thing to do. I don't worry so much about cleaning my cleaning surfaces. And then a question came up about, I see in the chat, is about giving an opinion on opening of the churches. Now, I would say that I don't want to keep anybody from practicing their faith, and what I am simply am encouraging, as we always have, as we have been doing ever since vaccines came out, is people who are going, if you're going to go to church and you're going to be in a congregate setting, you should be following these rules. I mean, these recommendations. You should be vaccinated. That is the single best thing you can do. You should wear a mask indoors, and you should socially distance. So if you are going to, you should follow those things, and then you are going to be greatly reducing your risk of getting infected or infecting someone else. And if you have access to a rapid test, you can do it before you go into the church, even better. But I recognize most people don't have access to those rapid tests. But again, it comes back, I'm a broken record. Vaccination, mask, social distancing is what everyone should be practicing. I think, did I get all your questions, Mayor-elect?
Yes. No, you got all of them. And I thank you so much. And I'll make sure that if I can get your information, please provide it. I know I have it somewhere, but that was a whole lifetime ago. So let me get it again.
Yeah.
And then,
okay.
One thing Dr. Paxton, I think the Mayor-elect asked for was updates for statistics. We'll provide that to you. We do it every week. And I'm not sure if you have been briefed yet, but we have a special coordination meeting with some of the City of Atlanta folks once a week since the COVID started, where we run through all this data as well. So everyone on this email, or on this chat today, Zoom meeting, will get an updated copy next week, sir.
Good deal. Thank you so much. And I'll look forward to that. I'm sure I'll be able to get coordinated with that. And thank you all that asked about my conditions. I was very mildly symptomatic with a cold type, a few sneezes or coughs here and there, but nothing bad. So it's definitely easy to go undetected. So thank you all, and look forward to working with you.
Thank you.
Thank you, Mayor-elect Dickens. And I want to acknowledge that we have two more in the queue, Commissioner Ellis and Mayor Motley Brown. And wait a minute, but I want to also acknowledge that we have questions that have been popping up in the chat. And Jessica, I don't know how you want to handle those.
I would say, Vice Chair, I know that Commissioner Ellis has not had an opportunity to speak. We also, Mayor-elect Khalid from the city of South Fulton was also on the line and asked to speak earlier if he is still with us. And I believe Councilwoman Willis is also on the line. So I don't know how much time the board, how much time you all have, but of course, Commissioner Ellis has not had an opportunity to speak, and we've had a few other questions.
Yes,
and I'll try to answer those in the queue if we're able to. I think Dr. Paxton has answered some.
Yes, and Jessica, also, I noticed that someone put in the chat that they were going to have to leave. I think it was Mayor Steele.
Okay.
And Commissioner Morris, maybe? I
All
saw
right.
those pop up.
And I would just mention that this meeting is being recorded and live streamed, so we will send that link out for anyone who was not able to stay on the line.
All right, Mayor, Commissioner Ellis.
Sure. Thanks, Vice Chair. And I'll try to be brief so some other folks can talk. I just wanted to sort of say up front, I think the most important thing we can do from a county perspective is continue to do the good job we have done in terms of getting vaccines, out there and available, and letting the public know how they can access them and making it convenient for them. Right. I think that delivering that service continues to be critical. Is something we've done well, and I think we just need to continue to highlight that along with similar testing. So I think those two things are probably the two important things for us to continue to focus on at a county level. And then the third piece would be the sharing of data. I think it's definitely been highlighted by the discussion on the phone, whether it's weariness or whether it's tiredness or whether it's I guess the term I would use is more our citizenry probably is more, I would say on the balance of becoming sort of tone deaf to the issue of new precautionary measures and that sort of stuff, and when you should be doing this, when you shouldn't be doing that, and that sort of stuff. And I think part of that is because the messaging has changed and evolved over time. And there have been aspects where, the health community at large, we're dealing with something that's so new and volatile and changing, and you're trying to respond to it with real time, that some of the guidance that has been promulgated then has been pulled back and changed. So I think we do just all have to recognize that whatever we're communicating in terms of precautions and that sort of thing, outside of some of the basic stuff, right, that Dr. Paxton's highlighted, the importance of masking, the importance of being smart about what you're doing in large settings and in congregate settings and around particularly vulnerable people. I think we just have to be cognizant of the fact that we're dealing with a citizenry that is going to be somewhat jaded when it comes to and tone deaf to changing and moving recommendations, if you will. So I just think that we just all of us sort of need to acknowledge that as we're thinking about it, whatever we're doing in our particular jurisdictions. And I'm glad that our two we've got some of the mayor-elects on here. Certainly, it was great to hear from Mayor-elect Dickens, and hope he will continue to engage with us and join us in these discussions. And the follow up on his discussion is suggestion about providing and having a further discussion early part of next week. I think that might be wise too. And I think if we were going to consider, at least at the county level, any sort of closure or curtailment of, whatever we're going to term non-mandated services, that we look at that just for a very brief period of time and then come back and revisit that, perhaps a pause for just a week. So I think that suggestion of really looking at this very closely and following back up 1 week later is a very good suggestion, given how fast this has moved, and hopefully it moves, that quickly in the other direction. Certainly there's no guarantee of that, but certainly I think looking at this thing week to week, given its volatility, makes a lot of sense. So I'll end my comments with that.
Can I just give one follow-up? I forgot to mention our EPI reports that are put out we put out from the Department of Health that has all of this information in it. They are published onto the Fulton County website. And so if you ever, wake up in the middle of the night and want to find out what's going on, you can look at the latest EPI report on the Fulton County website.
Thank you, Commissioner Ellis. Thank you, Dr. Paxton. Mayor Motley Broom.
Thank you. Dr. Paxton, we've had an increase in our numbers in College Park, and it's prompted us to limit access to City Hall and some other facilities. And as a result of that, we've also brought in professional cleaning services to disinfect the building. Would that be your guidance generally moving forward when we have situations such as that. Certainly, we want to make sure that we're doing what's best for our employees, but it is a costly venture, and so we want to make sure that we are balancing those health and financial needs.
We have moved away from this mass disinfection. So, for example, we've had some breakthrough cases at the Board of Health. We do not bring in a disinfecting crew to do that because, again, this is a primary respiratory infection. So I think that so we do not say that you need to be doing this mass scale disinfection if you've had a case there.
Thank you. Appreciate that.
Thank you, Mayor Motley Broom. Mayor-elect Khalid.
Hi, thank you, Commissioner Hall, for recognizing me. Can you all hear me all right? I'm on a phone.
Yes, we can hear you.
Perfect. So, and this is a comment and a question for Dr. Paxton, just around messaging. I do think it's important that we are not yelling COVID in a crowded theater. It is my understanding, please correct me if I'm wrong, but that no one who is vaccinated has died from the Omicron variant.
Not that I am aware of, but again, as Doug explained earlier on, I hope that you were on, is that death is always a lagging indicator. So we're not expecting to see this, perhaps, deaths from Omicron alone. But also, let me remind you, we're still seeing lots of deaths from Delta in our
Right.
hospitals. So yeah, okay, go ahead. I'm sorry.
Yeah, no, it's fine. I do think, if we have that data, if it's available, I think that is probably one of the most persuasive things to convince people to get vaccinated, right? When we reconvene, I don't know, I wasn't on at the beginning of the call. I don't know if there are attorneys in the room. I did hear Mayor-elect Dickens talk about the outdoor vaccination, the outdoor inauguration, and that they were requiring proof of vaccination. I'm just wondering, we were considering here in South Fulton, after 22 months of virtual meetings, we were considering opening our meetings back up. I understand that at this time, that's probably not wise. But whenever that does happen, do we have any sort of stare decisis or legal guidance around requiring vaccinations to enter buildings or to come to meetings, even beyond the inauguration? Like, if there's any sort of policy guidance around requiring proof of vaccination?
Well, I'm really glad that Dick is on the line. I don't see the lawyers here, so I think that he might be in a better position to talk to you about that in the absence of lawyers being here.
And excuse me, Dr. Paxton, the county attorney is on the line, but I would say that the cities should likely collaborate with their respective city attorneys. I don't think we're prepared to give legal guidance writ large, but
that was a great answer, Jessica, one I should have thought of.
No, listen, that's fine. I know that it's something that we'll be talking about in our cities, but again, it was just more of a suggestion that if we're going to have another one of these calls next week, we might need to just consider that. I know that is something that is happening in other cities and other states. I don't, their laws are different than our laws. So it is a tool in our toolbox. If it is a tool in our toolbox, we would just need to know if that is a tool we could legally deploy. And then finally, and I have been communicating with our county manager, Mr. Anderson. Thank you so much for telling me about this call. And we have been given permission to use Wolf Creek Amphitheater to have an outdoor inauguration as well. So I would just ask if any decisions are made today about closing county facilities, that facility might still be made available to be open for us to have an outdoor inauguration, because right now we were planning an indoor inauguration. So I know that I've been talking with our city manager as well. I just wanted to make sure that we could leave that option on the table. And that's it. And those are my comments. Thank you so much.
All right, thank you, Mayor-elect Khalid. Jessica, do you still have the person on the phone who was waiting?
I believe that, I believe Councilwoman Willis, let me see if I can get her.
Good morning.
Can
everyone hear me?
Yes.
Good morning, everyone. Merry Christmas, and thank you, Dr. Paxton, and thank you, Fulton County staff, for all that you do, and the commissioners to keep us informed and safe. I just have one quick question. So avoid large crowds. Can you please put a number on that? 50, 250? What is the recommended number that we should have indoor or outdoor relative to large crowds?
I don't actually have a specific number, because a lot of it, again, depends on what your space is. Because if you had 10 people in a 10 by 2 square foot room, that's too many people. So again, it depends, because what you need to look at when you're looking at a thing is, can people maintain adequate social distancing, of at least 6 feet? And are they masked? Are they vaccinated and all that? So I think that, I can't give you an exact number, because it is so, so dependent on that. But again, you have to kind of use a little bit of your judgment on what it is. I mean, I think, but I'm certainly not imagining, I don't think that we should be having, office parties of, 25 to 50 to 100 people in an indoor space right now, particularly if they're going to be having to remove their masks to eat or drink or whatever, because that's kind of a problem. But I don't have a specific number, and I'm just, sort of winging it here.
And that helps. The thing is, many of the municipalities were considering going back indoor to having in-person meetings, and we were just, trying to figure out if we allow public in, which probably that won't happen for a couple of weeks now, based on the information you've given. What we should. And even some of the churches have gone back to in-person, and they have gone on a reservation system to allow just a certain number of people in. And I guess you will have more information when you all reconvene next week, but what you have just said was very helpful. Thank you.
Welcome.
Thank you, Councilmember Willis. I don't see any additional questions on the Zoom or in the chat, but I do have 2 that came up from constituents on my own phone. One wants to know, should the AUC Center go back to virtual learning? What would the recommendation be at this time for a college or university?
I'm not actually able, that recommendations, has to sort of be done in consultation with the schools. I mean, a lot of it depends on, levels of vaccination coverage, again, on ability to social distance and the like. So I don't have a blanket recommendation. This is something that we encourage, like, for example, the AUC, I would encourage them to talk with us. We're happy to opine on these things if we have all the data. Honestly, though, many of the level of the institutions of higher learning, they don't necessarily, they have a lot of access to their, to other sources of information and consultation. Many of them have, members of the Morehouse School of Medicine or Emory School of Public Health on their boards. And so often it doesn't even come to us. But we're there, we're open. And I mean, I'm always open for offering an opinion if they should want to reach out to me, but I don't have a blanket, opinion to give right now, because I don't have enough data from AUC.
Thank you, Dr. Paxton. Jessica, I think somebody just put a question in the chat.
This says there was a question about how a rapid test will be delivered to the citizens, and I think Dr. Paxton could speak to that.
Yeah, and I already tried to answer that in the fact that, but that was at the very beginning, so you might not have heard that. We haven't received the test kits yet, but these test kits that we're using to bridge the gap before federal test kits are available are coming from the money that we have been assigned from our equity grants. And so the distribution of these kits, we're working right now on the plan for them. And they have to be distributed according to the funding guidelines from this grant, i.e. so they need to target areas of low vaccination, high infection rates, and high levels of COVID disparities. So we will keep you apprised of this when we have worked out what the plan is going to be.
Thank you, Dr. Paxton. And are there any other questions from this body?
Vice Chair, I just want to mention that I did put my email address in the chat. If someone has a question after the meeting, we will certainly attempt to get that answered, and we will share the slides and the data from today. I know folks have a lot going on this weekend, but we'll try to get that information out quickly.
All right. And I know that this meeting was called because our county manager and our district director of the Board of Health wanted us to decide on some recommendations. Can either of you speak to that, please?
Can you hear me, Madam Vice Chair?
Yes, sir.
So I think the three broad categories, one, it seems like to me there's very much support that we continue, obviously, with maximizing the vaccination testing and information sharing, and we will schedule a follow-up to this meeting. Appreciate that recommendation being made. I think the second one is one that I didn't hear any objection to, so I'm assuming consensus that requiring masks in Fulton County facilities would be acceptable. If the board would like to take an action on that or a vote on that, we could do that. I think there was less consensus on closing senior centers, and it is a close call because it cuts both ways, as was mentioned. I don't think libraries fall into that same category. So the only one that probably, if there were debate and direction to give to us as a staff, would be on the closing of senior centers.
Thank you, Mr. County Manager. Does anyone have any questions?
Madam Vice Chair, this is Sheriff Labat. I do have a follow-up question for Mr. Anderson or whoever can answer. Not sure if there is any funding. I heard the good doctor mention several times about the sanitation process, but I know Dream has worked very hard to install air filters and alike. Not sure of two things. One, if the county as a whole, if different mayors have had an opportunity to have similar air scrubbers or filters put in place in city buildings, et cetera, and if there's any COVID funding available to do that. And then secondly, I'd remind all of our leaders to be cognizant and stay in communication with the first responders. The numbers are rising in terms of employees to levels that service will eventually be impacted. So I think that's something we just need to maybe put on the parking lot so that we can remain focused on that as well.
Thank you, Sheriff Labat.
Oh, and can I just say one quickie thing to follow up? I thank you for bringing that up about the air filtration. Filtration systems are very important. So if you are in a position to be able to upgrade your air exchanges in public buildings, that is a recommended thing to do if you have the wherewithal.
Thank you, Dr. Paxton. So, Mr. County Manager, you want input from the Board of Commissioners on the closing of facilities? Is that what your question was?
Yes, ma'am. And I think it's limited to senior centers.
So is our county attorney, Madam County Attorney, do we need to take a vote on this?
I'm not sure if the county attorney is able to unmute.
Can you hear me?
Yes.
Okay, I'm sorry. I think my ability to unmute has just been corrected. So this was done at a previous meeting by vote without a resolution. Today is a special call meeting for regarding emergency measures related to COVID. I believe that if we wanted to take additional measures regarding the closure of senior centers, the best course of action would be to do it by way of a vote. Was that the question?
Yes, ma'am. Just want to make sure for us to address the county manager's question, do we need to vote on it?
And I was looking to see if we have a quorum, and I believe that we still do.
All right. Just want to make sure that since we did approve an extension of the county manager and the chair's abilities due to emergencies, that whether or not we need to vote. So then I'll make the motion on what temporarily close. Yes, I see your finger, Commissioner Hausman. I'm glad I was looking at your box. Otherwise, I wouldn't have seen you.
Well, go ahead and make your motion and then I'll comment.
Okay, so Mr. County Manager, you want us to tell you if we will approve the temporary closure of the senior facilities?
Yes, ma'am. I think the recommendation from Dr. Paxton and also Dr. Rochelle is that we temporarily close the senior centers until we see improvement in these trends.
Okay, and for what length of time?
Well, not knowing how the trends will play out, I would say obviously at least next week, when I think we're open 3 days. And Dr. Rochelle can correct me, but I think it's 28th, 29th, and 30th. And then, of course, we would be back together with a board meeting the following week. So perhaps end of that week. So let's say a week and a half, and then we could revisit it at the January the 5th board meeting.
Yes, Mr. Manager, that's correct. The facilities are scheduled to be opened for 3 days next week. And then, of course, continuing the week of New Year's.
Okay, so we're saying December 28th, 29th, and 30th, and then come back on January 5th for another vote.
Yes, ma'am.
All right, motion on the floor. Do I hear a second?
I'll second it for discussion.
All right, thank you, Commissioner Ellis. I see Commissioner Abdul Rahman's hand for a question.
Thank you, Vice Chair Hall. I don't have a problem supporting this based on the recommendation of County Manager and of course Dr. Rochelle. However, I would be remiss if I didn't say if we are going to take that action only because I have heard from so many seniors. Have we looked at the numbers? Are the numbers spiking? Because I know we have been doing everything in our power, and all of the senior centers, they have been doing everything in their power to make sure that all the protocols are in place. And so I support it. Don't get me wrong. I hear what Dr. Paxton and also what our county manager and Dr. Rochelle. I just would be a little tad bit concerned with our seniors, because some of them, this is the holiday season, some of them have absolutely no other outlet. And I mean, it breaks my heart. I know this is where the hard decisions have to be made. But any additional support that we can give, if we're going to take this action, any additional support we can give for our seniors, I just would have to say we would really need to do it, because they are at a point, some of them now, they are suffering. They are really suffering. And so here again, I am in full support from a scientific point of view of what we need to do. But I also want us as individuals who represents our communities to hear that we have so many seniors out there that we have asked them to do this, to do that, to do this, to do that. And now they have been coming back into the senior centers, very controlled, very small. And it breaks my heart that some of them are struggling socially and struggling with depression. So I'm just asking if there's anything that we can do if we're going to take that position of completing shutting the centers down. And I understand why, and I fully support the reason why. I'm just saying, I'm looking at the full equation with our seniors, because some of them are really, truly struggling. And here we've got the holiday season upon us. Some of them have no families. Some of them, their social activities are centered completely around that center's life. And so with that, I would say I would lend to any advice or direction from my colleagues and the county manager's office with Dr. Rochelle. Thank you.
Thank you.
And let me ask Dr. Rochelle to respond to that. And also, Dr. Rochelle, if you could cover the one exposure that we did have in Adult Day, and then of course, just thinking out loud for a moment, Commissioner, we did have a very, I think, good event with the distribution of food to our seniors through the 4 multi-purpose supplant the ability to get together. So Dr. Rochelle.
Yes, thank you, Dick. So for the seniors over that 6 or 7 day period, we would of course continue with a meal provision. We can institute wellness checks where we would have the staff calling seniors to check in with them regarding how they're doing and just checking in. We can also offer the virtual programming during that 7 day period as well. We've had several exposures of staff that, thank goodness, turned out to be negative, but has impacted programming from the perspective of reducing it for the day or for the next day. So we are continuing to see exposures among the staff. And when that happens, we of course have notified seniors if they were in the presence of that staff person. But to answer your question, Commissioner, about what provisions we can institute some level of continuous engagement over the period of time that we monitor these conditions.
Thank you, Dr. Rochelle. That sets my heart much more at ease, that we do have some things that we can do to make sure that, you know, our mental wellness. I know we worried about the physical wellness of our seniors, but it sounds to me that you all have a plan in place for our mental wellness. So on that note, I will support the recommendation.
Thank you, Commissioner Abdul-Rahman, Dr. Rochelle, and Mr. County Manager, and Commissioner Hausman. did you want to go ahead? I remember you had your hand up.
Well, yeah, my concerns have somewhat been raised. I don't want us to have any sort of prolonged, longer than necessary interruption in these services for the reasons that have been stated already by multiple people. This is no time of the year to neglect and have folks in isolation. So I think that's been addressed. I think that it's reasonable to take a break for a temporary time period. But again, I sincerely hope that we're not going to take any action that will last longer than absolutely necessary if we take it today.
Thank you, Commissioner Hausman. Commissioner Ellis, I see your hand up.
Yeah, just one quick follow-up on the remarks from our previous two colleagues. I'm supportive of this, but I'm supportive of it with the caveat that at our next meeting that it be presented with us with a plan and recommendation for based on the data we're looking at that point in time, right? And for reopening them and potentially reopening them under different circumstances, more limited activities, et cetera. So, I want to keep it in front of us, just like the suggestion of keeping this in front of us sort of week to week. I don't want to make this prolonged. And I think given that we're bumping up against a bunch of holidays anyway, and it's not a full week, it's a partial week, it makes some sense to kind of give it a pause and then revisit it in full at our meeting on the 5th.
And we can do that, Commissioner Ellis.
Thank you, Commissioner Ellis. Thank you, Mr. County Manager. Are there any, I think I saw a question in the chat, Jessica, about the seniors?
There was a constituent question about senior centers and temperature checks. I think that this is something I'd like to work with staff. We do have Mr. Howard's email information. I just don't have the answer at our fingertips. So I think we'll
well, I can address the lack of temperature checks. We do not do them any longer because they have been shown to not reliably identify people who are who may be infected with COVID. So the juice isn't worth the squeeze.
Thank you, Dr. Paxton. And so if there are no other questions, I just want to say that I too have a concern about isolating our seniors. However, they are the most vulnerable population in this situation. Many of them are very fragile and have pre-existing conditions. And as we have seen with the most previous and current elections, there have been those elected officials who did not act expeditiously when we had a surge before, and they did not close down. They didn't do mask mandates and someone died, and they were not reelected because their constituents did not appreciate that at all. So I just want to say that to say, I think that we do need to be careful and make sure we do all that we can to keep people safe. So the motion on the floor, Madam Clerk, can you just reiterate the motion on the floor, please?
Okay, yes, I have the motion on the floor is to temporarily close the senior centers, to the senior centers until we see the improvements in trends. But I think that what I have is that from the 28th to the 30th, is that correct?
Yes, ma'am, that is correct. 28th, 29th, and 30th.
Okay, and that was a motion made by Vice Chair Hall, seconded by Commissioner Ellis.
Excuse me, was it not also to revisit this in our January 5th meeting?
Yes, ma'am, that is correct.
Okay, so noted.
Mr. County Manager, I saw you unmute.
Yes, I was just thinking out loud for a minute. I think probably the best way to phrase the motion is temporarily close the senior centers with a review of trends in the January 5th Board of Commissioner meeting to determine when to reopen. So it would be closing from now until then. Since you have that first day or so, we would be closed again on the 3rd of January, but then we would reopen on the 4th, only to then have the Board of Commissioners meeting on the 5th. So it's probably from now until the January the 5th, and then a review of the trends on the 5th, seeking direction from the Board of Commissioners at that meeting.
Thank you, Mr. County Manager, for that clarification.
Okay, so I'll remove the 28th through the 30th and revisit at the January 5th BOC meeting.
Yes, thank you. So let's vote. Yays, any nays? I don't hear any nays, so we can say that this passed. I don't hear.
Would you like for me to call? Would you like for me to call each commissioner?
Please do, yes.
Okay, Chairman Rob Pitts, Commissioner Liz Hausman.
Yes.
Commissioner Bob Ellis,
Yes.
Commissioner Lee Morris, Vice Chair Natalie Hall,
Yes.
Commissioner Marvin Arrington Jr.,
Yes.
and Commissioner Khadijah Abdul Rahman.
Yes.
Okay, it's 5 yeas, 0 nays.
And as a follow-up, the plan that Dr. Rochelle outlined will be conducted during the interim that its facilities are closed, correct?
Yes, ma'am. We will start to notify seniors through our mass communication system. We have everything in place to begin the meals, and we will direct the staff to start the wellness check calls and the virtual programming during that period.
Thank you very much.
You're welcome.
Thank you very much. Are there any other matters to be considered today? Madam Clerk?
No, I have no further madams, Vice Chair.
All right, thank you. So if there are no objections, meeting adjourned.
Merry Christmas, everyone.
Merry Christmas.
Merry Christmas.
Bye.
Merry Christmas.
I'll see you later.
Merry Christmas, everyone. Merry Christmas.
Merry Christmas.